The bottom line is that, again, cybersecurity isn't an IT issue. It's a shared responsibility across the whole organization.
Magandang umaga sa lahat, maayong buntag and maupay na aga. So good day everyone and welcome to the 15th session of UP Manila SILab webinar series IOL 2025 to present the topic on protecting patients in digital age, cybersecurity and national health systems. Let us virtually welcome Mr. Ronald Allan Pablo.
Thank you, Gabby, for that introduction. A large chunk of my career has been in government service. I actually spent more than 20 years in the Philippine Health Insurance Corporation. The outline of this webinar, we would be focusing on the following subject matters. First, an introduction and context setting, the digital health ecosystem, opportunities and threats. We would be discussing a case study, specifically the PhilHealth ransomware incident, cybersecurity strategies for national health systems, then moving forward, resilience and collaboration. Healthcare is going through a major digital transformation. Health systems are basically attractive targets. Medical and personal data, it's highly valuable. We've already seen ransomware attacks, phishing scams, data breaches in both the public and private sectors here in the Philippines, even across the globe, causing major disruptions and data leaks. Health data is among the most sensitive types of personal information. And because of its depth and value, it's a common target for cybercriminals. As healthcare becomes more and more digital, with electronic records, remote consultations, and now artificial intelligence tools, there's a growing need to pair innovation with strong security. So that is why cybersecurity isn't just an IT issue. I can't keep stressing that enough. It's a core part of delivering reliable and secure healthcare. Cyber resilience is about making sure that these three principles are maintained: confidentiality, integrity, and availability, even when systems are under attack or facing technical issues. That's why cybersecurity needs to be built in from the very beginning or from the very start. It should not be treated as an afterthought. Given how quickly these risks are evolving, healthcare organizations really need to continuously strengthen their cybersecurity. So why is health data high value? On the dark web, it can sell for 10 to 20 times more than credit card information. One of the most significant cybersecurities in recent Philippine history, particularly in the Philippine health sector, is the one which involved the Philippine Health Insurance Corporation on September 2023, when it was targeted by the Medusa ransomware group. So the National Privacy Commission initiated a formal investigation. So during the inquiry, PhilHealth officials confirmed that the antivirus protections at the time were already outdated. It was not solely a result of technical shortcomings, so it reflected broader failures in governance and risk management. So integrating governance, controls, and risk oversight is essential to building a resilient digital health system. This is a slide of the 3 lines of defense model. This slide breaks down the 3 main types of information security controls. These are organizational, technical, and physical. This slide shows a simple way to classify healthcare data into 4 types. So you have patient data, clinical data, administrative data, and research data. This highlights the 5 pillars of data privacy accountability from the National Privacy Commission. So when working with vendors or service providers, you have to assess risk. Next, you have to do your due diligence. Trust is a very important factor when dealing with third parties. And if there's a breach, there should be a clear plan. Know who gets to be notified, particularly if you take into consideration the requirement for NPC guidelines for breaches to be reported within 72 hours. This slide is about building a strong culture of data protection. This is something that goes hand in hand with your technical and your organizational security controls. When we talk about cybersecurity, it's not just about technology or not about information tools. It all has to be anchored on strong governance.
A follow-up question. So interoperability is all about openness and sharing data, but cybersecurity is about restricting and protecting access. So how do we find the sweet spot between the two, especially in a healthcare setting where both patient safety and privacy are critical?
I think there is a misnomer that cybersecurity is all about preventing access to data. Well, in a sense, that is correct. But as long as, for example, we apply the Data Privacy Act, if what we are doing is considered a legitimate purpose, if we're protecting the welfare of citizens, that can easily be justified as a use case for data sharing. Cybersecurity will not go from the very beginning and say you cannot do this, you cannot do that. It will look at the use case, then recommend ways in either to secure that. It's about doing what we need to do to ensure public health in general, then implementing the appropriate organizational, technical, and physical measures to ensure that that processing of data is safe.
Thank you again, Sir Ronald. And of course, thank you all for joining us. And since it's the last Wednesday of June, I want to take a moment to wish everyone a very happy Pride. So let's carry the spirit of inclusivity and safety, not just in our digital lives, but in all aspects of our communities. Magandang gabi, magandang umaga sa lahat. See you next week. Bye!